Hey guys, this is Dr. Tom with the Doctors of Physical Therapy. This video is the follow-up to the Bulletproof Your Core workshop. We're going to go through those 4 main activations of the muscles of the deep core. We're going to start with your transverse abdominis. Remember to put your thumb just inside of those hip bones that you feel protruding from the front of the hip here. It should be a little bit soft if you disengage your core. You're going to do first a hollowing, so you're going to actually pull the stomach in, and second, you're going to clear your throat. You should feel a slight bulge into your fingers. You want to hold that hollow as that bulge takes place, so that way you're not just hollowed and you're not bulging out completely. The second thing is the diaphragmatic breathing, so we're doing the roof of that core. So take a deep breath, and if your chest raises, you're not breathing into your diaphragm first. So you want to make sure that you take a deep breath into your stomach there, okay? And if you can hold a transverse abdominis contraction while taking a deep breath into your stomach, you should feel a very stable, rigid posture, which would be good for overhead loading or squat rack loading, front squats. That's also a good posture for that. But keep in mind that if you breathe with your chest, you're going to be creating a more unstable environment than when you breathe into your diaphragm. The third one is the pelvic floor. You're going to start with the back passage and squeeze the back passage tight and zip that up through the front. One great way to emphasize this is to do that with a transverse abdominis contraction as you're jumping rope. Okay, that way you're working against gravity. And the final one, and the most important because it's the most commonly turned off in people with chronic conditions, is the multifidus activation. So remember, to find your multifidi, you're going to put your hand right along your spine, and then you're not going to move your fingers, but you're going to change your pressure just slightly off to the right. Okay, to check your multifidus activation, you're going to raise your opposite arm, okay, or take a step with your opposite leg, and you should feel those multifidi activate. Now, if you do not, you can practice getting that transverse abdominis activation while doing the step or the arm raise, okay? And if you're still having trouble, you can break it down into this hip hike exercise that forces the multifidus to activate. So what you want to do is start with one leg a little bit higher than the other, on all fours, tabletop, back flat, and all you're going to do is lift that leg until the hips are even. Okay, so you don't want to blow past even, and you also don't want to bring the hip up like that. You're just picking it up to even and setting it all the way back down, and then reinitiating. Pick up to even, set it back down. Notice that when you do this, your lower abdominals have to activate anyway. All right, so that's the follow-up to the course. Make sure you subscribe to our newsletter that we send out periodically that'll give you additional tips and tricks how to advance those exercises and work on other parts of your body as well. All right?